Today we will talk about the Brucella. First of all, we will look at the characteristics of the Brucella. Brucella causes brucellosis in both humans and the animals. Brucella is a gram-negative bacteria. It means it will look pink in color in gram staining. Shape, it is small coccobacilli and it is non-motile. It requires oxygen, so that why it is aerobic in nature. Non-spore forming, it do not form any spore. Growth grows slowly on enriched media in blood or tryptic soy so agar. Colonies will look small, smooth, and translucent. Biochemical properties, it is oxidase positive, catalase positive, and urease activity varies among the species. So this is the biochemical properties of the Brucella. Next, we will look at the classification. So domain bacteria, phylum Proteobacteria, class Alpha Proteobacteria, order Rhizobiales, family Brucellaceae, and genus Brucella. After that, we will look at the species. Brucella abortus, present in the cattle. Brucella melitensis in goats and the sheep. Brucella suis in pigs. Brucella canis in the dogs. Brucella ovis in the sheep and the non-zoonotics. And Brucella neotomia, that is present in the rodents and the non-zoonotic. So this is the important species of the Brucella. If we look at the epidemiology, it is endemic in various regions in the world like Mediterranean basins, Middle East, Central and South America, Africa, and Asia. Reservoir, it is present in domestic and wild animals like cattle, sheep, goat, pigs, and the dogs. But the humans are accidental host. Transmission, direct contact with the infected animals. Consumption of unpasteurized dairy products like the milk and the cheese. Inhalation of aerosols in laboratory or occupational setting like veterinarians and slaughterhouse workers. So that is the important thing. Next, we will look at the pathogenesis. So, how Brucella enters in the body of the humans through the mucous membrane, aberrations, and the ingestion. Next, invasion. Bacteria phagocytose by the macrophages and the monocytes. So, monocytes and the macrophage phagocytes the bacteria and invade intracellular killing. Survive and replicate within the phagosome. That is the important thing. It means that Brucella can survive within the cell. Spread. It spreads through the bloodstream to multiple organs like the liver, spleen, bone marrow, and the lymph nodes. Immune response, activation of both innate and the adaptive immunity after entrance of the Brucella in the body of the patient. Chronic infection arises due to immune evasions. Clinical features, this is most important. Brucellosis in humans presents with acute and the chronic. In the acute, you will see the fever, indolent or intermittent fever. It means fever will not be the continuous one. Sweats, night sweats with characteristic wet hair odor, fatigue, joint and the muscles pain. Chronic brucellosis, persistent fatigue, arthralgia, arthritis, pain in the joints, neurobrucellosis, neurological involvement, endocarditis, rare but potentially fatal. Complication, osteoarticular involvement, spondylitis, and sacroiliitis means the pain in the junctions of the two bones, sacrum and the iliac bone. Hepatosplenomegaly and reproductive issues in the animals like abortions and the infertility due to the brucella. Next, laboratory. How we will diagnose the Brucella in the laboratory? Specimen collections. A specimen can be blood, bone marrow, or the tissue samples. Culture requires specialized media like blood. Next, slow growing. Brucella is slow growing, so it can take up to 21 days. Serology, Rose Bengal test for screening. That is the important one. Standard agglutination test SAT and enzyme linked immunosorbent, let's say ELISA of the Brucella. Next, molecular technique like PCR for the detections of the genetic material and microscopy rarely used due to low sensitivity. Treatment, antibiotic therapy, combination therapy to prevent the relapses. So most important, doxycycline 100 milligram twice daily and the rifampin 600 milligram once daily for 6 weeks. In severe cases, streptomycin and gentamicin can be added. Duration regimen will be 6 weeks or more. So you have to remember the durations of the treatment. Pregnancy, rifampin and in the pregnancy, trimethoprim sulfamethoxazole TMP SMX are used instead of the doxycycline. So this is the treatment of the Brucella. Next, prevention and the control. Animal control. Vaccination of the livestock, REY1 vaccine for the sheep and the goats. So that's why Brucella will not transfer to the humans from the animal. Testing and culling infected animals. Food safety, avoidance of unpasteurized dairy products. Personal protective measures we can use like gloves, protective clothing for occupational exposures like the in the laboratory. Proper handling of laboratory samples and public health measures. Education about zoonotic transmission and surveillance and reporting of the outbreaks. Key, observe the outbreaks of the Brucella in a certain society. Next, we will talk about we will discuss the important MCQs related to the Brucella. So, which class does Brucella belongs to? So, give me the answer. Yes, alpha proteobacteria. So, you just try to answer first before I talk to you. Which species of Brucella primarily affects the cattle? So, that will be the Brucella abortus. Next is the Brucella is classified as which type of bacteria? It is gram-negative Coccobacilli. What is the oxygen requirement for Brucella? It is aerobic. But in some cases, you can also see the certain species of the Brucella that can be facultative, but mostly it is aerobic in nature. Which enzyme is typically positive in Brucella? That is urease. The most common route of human Brucella infection is through inhalation of aerosol, vector-borne transmission, consumption of unpasteurized dairy products. That is the most important one because it comes from the animals. So it is an animal source. Which occupational group is at the highest risk of Brucella infections? Teachers, veterinarians, miners, and software. So veterinarians because they are in direct contact with the animals. Brucella is considered a zoonotic pathogen. What does this imply? Primarily infects plants. No, it is not related to the plants. Can be transmitted from animals to human. That it can be the answer. It causes disease only in human. No. Brucella can also cause disease in animals as well. It requires vector like mosquitoes. No, this is not a malaria. Which cells do Brucella primarily invade and replicate? Oh, that is the most important. Neutrophil, red blood cell, macrophages, and platelets. So macrophages will be the right options in that case because Brucella replicates in the macrophages. Brucella survives intracellularly by inhibiting phagocytosis, suppressing T cell activation, preventing phagosome lysosome fusion. So actually it can prevent itself from the lysosome fusion. So that will be the right option. Next, what is the hallmark symptoms of the brucellosis? Undulant fever, intermittent fever, not continuous one or rash or severe cough. So that is the most prominent symptoms of the brucellosis. Which one of the following is a common complication of chronic? So that will be the endocarditis in chronic cases. Next, neurobrucellosis refers to the involvement of which system? Neuro represents the nervous systems. Which diagnostic method is most specific for identifying Brucella DNA? So that is the PCR. Next, which serology test is commonly used for initial screening of Brucellosis? Ross-Beckel test. Why are blood cultures not always reliable in diagnosing brucellosis? Because it is fastidious. It requires more harsh condition for the growth. Which antibiotic combination is recommended for treating brucellosis? That will be the doxycycline and rifampin. What is the typical duration of antibiotic treatment for brucellosis? That will be the 6 weeks. What is the most effective measure to prevent brucellosis in humans? So that will be the vaccinations of the animals. Which of the following is not a control measure for brucellosis? So that will be the regular deworming of livestock. It is not for parasites killing. It's for pasteurization of the milk culling. So this is the right option. So this is all about the brucellosis. If you still have any question, you may ask in the comment section. Thank you so much.